Welcome to the Regional Health Solutions podcast, powered by Statum.
We're your hosts, William Munt and Jaden Frame.
Welcome back to the Regional Health Solutions podcast. So we're into season 2 now, and this conversation is one that we've been really looking forward to sharing. Our guest today is Margot Morton. She's the co-founder of CareZen. Margot grew up on a sheep and wheat farm outside Wagga Wagga, and she spent her career in healthcare, including rolling out virtual care programs during COVID, where she saw firsthand how real the digital divide is for people in rural and remote Australia. What CareZen built in response is genuinely clever. It's a virtual care pod. Think of it as a phone booth for the 21st century that combines Starlink connectivity, soundproofing, and AI-assisted onboarding to give anyone, regardless of their digital literacy, a private and reliable way to access healthcare. There's no forms to fill in, there's no tech skills required, just touch the screen and see a doctor. With pods already operating across 3 states, including Queensland, New South Wales and Victoria, and results that are turning heads, Margot is very much one of the doers in our industry. It's a great conversation, and we're excited to bring you Margot Morton. We're here with Margot Morton. Margot, thanks for joining us.
Yeah, thanks, Will. It's great to be here.
Margot, did you want to give us a bit of a feel as to how you found yourself in the role and position that you're in at the moment?
Yeah, sure. So I grew up in the bush. I grew up on a sheep and wheat farm about 10 kilometres southwest of the Rock. And the Rock is about 20 kilometres southwest of Wagga Wagga. So I'm a Riverina girl, and I grew up catching the Spirit of Progress into Sydney to boarding school and Spirit of Progress back. So it's all very good fun. But what that did is it gave me a great affinity for the bush, and my career has always been in healthcare. And more recently, I was involved working with an organisation to roll out virtual care programs for COVID. And the organisation I was working for, we were the medical escalation point for high-risk patients. And what I saw then was that there was a great disparity of those who can connect to virtual care at home and those who cannot. And the digital divide is real. We can read the statistics, but until you're standing in a rural or remote town and realise that they've just given up in some instances of accessing care, that I put my head together and decided that we would design and build virtual care pods. So we would whack some Starlink on the top of them, make sure that their connectivity, make sure that they're built for digitally excluded people so that it's an intuitive connection. And now I'm doing the best thing I've ever done in my life, in my career actually, which is connecting remote, rural and regional communities to virtual care in pods.
That's fantastic. And you reached out to us, just for the audience's benefit, after listening to our first season of our podcast, because you connected with the idea that we're trying to tap into innovative ways to be able to deliver that care the more regionally and remote you become in Australia. For those who haven't done their research yet and, you piqued their interest, what's the pod? Explain the pod to people.
Yeah, so basically I saw that there was an issue where people didn't have a private safe space that they could connect to virtual care, right? So we also saw that Australians embraced virtual care during COVID. They were okay with talking to the doctor on the telly. But what they were excluded from is, 90% of Australians live with other people. So very difficult to have a private, confidential consult at home. We also see that 44% of Australians struggle to complete online forms. Not enough digital literacy to complete those online forms. And we know that there's lengthy online forms to complete to access virtual care. And we know that, 11% of Australians, which is just crazy, 11% of Australians still don't have an internet connection where they can have a video consult or have any type of video stream, any type of video. So when I put those 3 things together, my co-founder and I, Megan and I, we sat down and we designed a virtual care pod that would have Starlink on the top of it, so we could guarantee 160 megabits download, so good quality video, because everybody knows once you've had a bad experience, you don't want to go back. We also designed that it was soundproof and it was comfortable and wheelchair accessible, or you could fit yourself and a support person in there. And then here came the real crux. To remove the online forms, to make it easy for people, we actually are using, at the moment we're testing, but we're using Gen AI. So it's a talk to text capability. So all you need to do is be able to say your name, date of birth, and read out your Medicare card number to be able to connect to virtual care. So we're very, very close that somebody who has no literacy, no numeracy will still be able to connect to care. Just the same way as you, on your smart TV, you can touch on Netflix and you go into the Netflix environment. You can touch on Stan and into the Stan environment. The technology that we put in the pod means that you can touch on the screen and you can go through to primary care to see a GP, or you can touch on the screen and go through to an emergency physician. So different virtual service providers. So the results we're getting already are just so exciting, so exciting. Like a pod up here in Central Queensland, 34% of the patient cohort identified as our First Nations community, where the broader community within Central Queensland identifies at 7.8%. So that's really showing that we're actually reaching an underserved community for healthcare. 99% of that cohort have said that they felt comfortable and they would recommend the pod and they would use the pod again. 88% said that they had never accessed any type of virtual care before and that they absolutely loved this. So it was culturally safe and culturally appropriate. So I'm coming to you today from the pod on the campus at Central Queensland University. So it's very exciting.
I love it. A pod from the pod. Love the concept. Margot, so I consider you a health innovator, and it aligns to our why at Statham in terms of increasing the livability of regional rural Australia by improving the sustainability of health in rural Australia, because that's what underpins our livability. So you can see where our whys align very much to that. So, but being a health innovator, tell us about some of the challenges in your journey of change and innovation in health.
Oh gosh, and quite rightly so. We come from a very conservative decision-making framework in Australian healthcare. And it's really interesting. We have a lot of conferences and a lot of podiums for people to speak from, to present research. But I have to challenge the fact that we don't have a lot of the doers on those stages saying what they're doing to actually make the change. I would challenge that we spend a lot more time talking about the problem and the challenges than the actual roll our sleeves up and get on with it and find a solution. So, I broke all the rules. Anybody will tell you. One, I'm bootstrapping this business, which is almost breaking us, but we're doing it. We just built a prototype and we got it out there and we got patients in it. We're not spending 10 years doing R&D and trying to perfect things. We've got a big, ugly prototype that
working.
Looks like, that it's working. Exactly. And each model, each time we build another pod, it's getting smoother, aesthetically more pleasing. But the fundamentals are the same, that we've built it to NSQHS standards. It's a hospital environment and it's easy and intuitive to use to connect to care. So they're our foundations. But yes, it's very difficult. It's very difficult. Like, sometimes I say to people, I go, are you okay with the phone booth? And they go, yep. And I'm like, yeah, well, it's just a phone booth with a video capability in it, right? So we had phone booths in 1930. So let's get a gallop on and see whether we can connect more people to care, provide them a private, safe space. But it's a conservative decision making.
I can see huge benefits from specialist services, oncology, where a lot of the services aren't required to be face-to-face or even health funds. When you look at growing the private health value proposition in the bush, being able to actually access a specialist that you can claim for private health, I can see how how the health funds would jump at an opportunity to partner with CareZen. But when you look, so what you're doing, you talked about the phone booth was in the 1930s, and we finally got CareZen with these pods popping up around Australia. Where do you see the next 10 years in regional rural health? What's your vision? Do you have a vision, and what do you think it looks like?
Yeah, look, I very much have a vision on that. We are working towards, we are coming quickly towards a tsunami of workforce shortage, which is dreadful for medical workforce, particularly for our regional and rural. We're an aging population. 10 years down the track, the majority of us will be over 60. Our social determinants and our social frameworks in 10 years' time are different. You know, our young folk are leaving the country and heading into the city, to your point, that it's not livable enough for them. So we are heading towards some pretty chronic health and a larger disparity between those who have and those who have not, unfortunately, is what I see for the next 10 years. So hence, I would say that absolutely spurs on my passion to work towards, to your point before, you know, that people don't have to travel back to the tertiary facility for their 15-minute follow-up checkup with their specialist. They can just pop down to the pod that's sitting outside the post office, you know, and hop in and see their specialist virtually on the video in privacy, confidential, or they can just connect to a GP to update their prescription medications, or they can just connect to a virtual GP to receive a medical certificate for little Joe who can't go to school today. You know, I think we need to be more connected. I think that in 10 years' time, virtual care will just become part of the norm. But the infrastructure and investment needs to be made so the disparity doesn't get worse between regional and rural Australia and metro Australia.
Yeah, I have a thought process that any change in regional rural needs to be anchored to a local LGA and driven from a local level.
Mm-hmm.
So when you look at local communities, how can they be empowered, or how can they support that vision of increasing the health services or health provisions in a region?
From a local level, like the CWA, basically, what we can do is we can spend more time in investing in preventative care. I think preventative care is definitely, from a local level, what we can do. So, you know, we should have more information, and this is something that I've put into the pods as well while they're waiting for the doctor, that they get local preventative care information. And that's something really simple, Jaden. Like, did you know, Mrs. Jones, that at 8 o'clock on Saturday mornings at the town hall, we all meet to get our 10,000 steps done, you know, for a walk along the Fitzroy River? Or did you know that the IGA has got these fruit and vegetables on special for a heart-healthy recipe? And would you like me to send that recipe to your phone? So preventative care from a local level, I think that's what we can really concentrate on. There needs to be more encouragement on healthy living.
I might try and elaborate a little bit further on that. Like that has to be the future trends and models of care that we'll see, because we're in a very reactive healthcare landscape. You would agree?
Yes.
Yes. I'm interested if you've got any research or any, I suppose, if you've had any conversations or know what is out there that aligns with what you're doing. I was going to say trying to do, but you're actively already doing with the pods in around Medicare, in around private health insurers and those kinds of models to actually incentivize their use. Because my experience in the health industry is that it's chicken and egg. You start, and you've said it, you know, letting perfect get in the way of good is the paralysis of why innovation happens. The second reason is generally because there's no funding for it. And so what I've seen, you know, in my experience is that innovation happens and then the funding catches up to be able to provide the care that has demonstrably improved healthcare. So I don't know if you've got an ability to elaborate on that, or conversations you've had to see, you know, are the jungle drums beating in the direction that this is the way that our Medicare and state governments are trending, and private healthcare models are trending to try and incentivise that preventative medicine in this way?
I think the short answer is yes, they would like it. From what I see, yes, they would like it. If I look at the private health insurers, I'm going to give a call out here to Westfund Private Health Insurance. I don't normally do this, but I am going to do this with Westfund Private Health Insurance because their strategic imperative is to double down on the bush. So they're investing in the bush while others are pulling out. So, and when I say investing, they're investing in care programs, they're investing in their members, they're building more jobs within their care centres, and they're not pushing their members to be online, and they're offering more preventative care. Now, that's the sort of behaviour that we want to see in the bush from large corporates, right? It's from a private health insurer. It's definitely what I want to see. I'm not with Westfund, by the way. I just put a little asterisk over that.
Jayden talked before that anchoring this to an LGA or the community often gets more runs on the board when we are able to do projects, right? I can see that the regional HHSs would also have a dog in the fight. Are there other stakeholders in your journey that you've come across and had to liaise and partner with? And I'm thinking, the wider community, the policymakers, other providers of healthcare that have aided your journey that you'd be able to guide others on who are trying to do not necessarily pods, but similar innovation?
Yeah, absolutely. Absolutely. Look, I know a lot of private vendors are bleating at the moment that they're over pilots. They don't want to hear about another pilot, but we have to do pilots because that's the way Australian healthcare is built, right? To do pilots. And if you're talking at the state level, you must put your model together and your project together with the deliverable outcomes and in a pilot mode. Now, one thing we've done differently, which is being embraced, is that we have real-time data evaluation. So you can see in real time the utilisation of the virtual care pod, and you can see the patient experience data. You can also see connectivity uptime and technology uptime. So the client, which could be the state health department, has access to be able to see across the state the utilisation that's happening within the pods in real time. So what that means to them is they can pivot if it's not working, or they can send a champion in with change management to educate the community. But more so what it means is that they don't have to get to the end of the 12-month pilot and find that it's been subscale and pay a private consultancy house to do a $100,000 paper to show that it didn't work. So if my advice to anybody is absolutely go with pilots, absolutely have different commercial models, have an OPEX model. We lease all of our pods, and that's for a couple of reasons. I lease them because I want to keep the asset, because they're big, bulky things in some aspects if we do outdoor ones with gensets and Starlink. And the last thing I want as a legacy is that pods are littered across the country because a politician got excited about buying 100 pods and putting them everywhere. So I lease the pods and they have a lifetime of 60 months, so we can take them back from a sustainability measure. But if you're to do this, you should also have a CapEx model as well. So have varying models. Then it's all about evidence. Well, Jayden, this evidence. And if you can get the evidence in real time, that's where you start to see the policymakers sit up and they look and they see that their constituents are happy and embracing a different model of care and receiving what they need rather than travelling all the way across the country to get to the city tertiary facility.
That's a perfect segue into my next question, which is evidence. What kind of practical outcomes have you seen so far? What are the success stories, I suppose? What are the runs on the board? what are the pods already delivering?
Yeah, okay. So we work with virtual service. We're agnostic to platform and agnostic to virtual service provider. So we work with our clients in a co-design workshop to design what is the gap that community needs. And the system that we have means that we can change it up. So if they're lacking a GP, so for example, if Dr. Smith at Lockhart needs to go on holiday and he hasn't had a holiday for 12 months or 18 months or hasn't even been able to play cricket, he needs to step away. I can actually put another one of his doctor's colleagues in there as a virtual service provider. And those people can go, and the messaging within the pod can be, Dr. Smith is away watching his son play cricket this week. But however, you're going to have Dr. Jones, who's a friend of Dr. Smith's, and all the notes today will go back to Dr. Smith after your consult, right? So there's that capability within the pod that our GPs, and we can use that as an attraction and retention strategy. So in regional Victoria, that's the model of care that we're looking at the moment to help GPs who haven't been actually able to leave town for over 18 months and they just want to take a holiday before they end up divorced. We're also looking at models of care where they can use the pod as a retention and attraction strategy that they can offer their doctors 3 mornings a week that they can work from home and be rostered to the pod, right? So therefore, they can get a balance of on the floor and some virtual work. It's really a beautiful way that they can actually take time out away and just deal with the low acuity for a couple of days or a couple of mornings a week, and then come back on the floor and deal with the more complex patients. So the pod offers that, and that's another one of the model of care. The greatest success we're having is the low acuity patient that can't get in to see a GP. I think Broken Hill at the moment is 12 weeks before you can see a GP.
Wow.
Right. It's just crazy. So, and for the pod is offering for low acuity patients that need repeat prescriptions, medical certificate, low acuity T4, T5 conditions where their care can commence virtually. We're seeing great success there. So I don't think I've had any patient through the pod that hasn't given us a 10 out of 10 for the experience. I've put some boundaries in place that the call must be answered in less than 15 minutes if they use a private virtual service provider. And I won't use a virtual service provider that doesn't have the capability to attach or offer the patient to connect the clinical notes from the consult to my health record or back to their existing GP. Virtual care is in between care. It's not always care, right? Virtual care is for when you can't get in to see your GP. So therefore, if you are going to have virtual care, it needs to go back to your in-person GP, or at the very least attached to my health record with the patient's consent. The virtual care pods and virtual care enables a continuity of care when it's done properly. But I do not want the messaging ever to be that you can just have a pod and never have a doctor.
Yeah.
We come back to that preventative care.
And I think we talked to Dr. Jeff Argus in Series 1, and he definitely sort of resonated that virtual health supplements the face-to-face and doesn't replace.
Absolutely.
Collaboration is often the key, Margot, and what you're doing down in Glen Innes is a really good example of local communities coming together and collaborating. Can you give me a bit of an overview of what's happening down there?
Yeah, so we're working with Hunter New England Central Coast PHN, and they have a great program to give back to the bush. And so we're working with them and a virtual service provider that they have chosen, that they work with, to provide mental health consults in the pod. So there's GPs in town, so that's not an issue. But what they don't have is they don't have psychologists or psychiatrists available readily. So the GPs are all in favour of this, that they will do the referral, and then the patient can just come to the pod, private, safe space, and they can connect to care Again, Starlink. So it's really nice, beautiful, high quality connection. And they can connect and have their mental health consult in private. And then once the GPs might want to go on holiday or they may leave, and then we may switch the pod from mental health appointments to also GP on demand. So there's lots of opportunities there for particularly these little towns that have a population of less than 5,000.
Yeah, excellent. Margot, finally, is there one message you'd like policymakers, providers and the public to take away about regional health, and what would it be?
Oh, gosh. It's not just throw buckets of money at it. It's actually sit with the people, listen to what we need, understand what we want for the future, and not get carried away with all these urgent care centres throwing millions of dollars and cutting ribbons. Really listen to the community, I think. Sit down and try not to put things in place without a clinical advisory. Like get Dr. Argus on board, and listen to what the clinicians who actually live in the bush will tell you what they need. So I think there needs to be more listening and not ribbon cutting.
Excellent. And listen first was one of our speakers, Jason Eldering, talked about listen first was his recommendation. So I love that.
We will put your details obviously in the bio and in the description of the podcast. Have you got anything else, Margot, in regards to, say, a GP or a health service or a RAC or a private hospital, whoever wanted to reach out and make contact to progress the next steps? How would they find you?
Oh, look, they can find CareZen on we've got our webpage, or the best way is to connect with me on LinkedIn. So it's Margot, like Margot Robbie, but I'm the old healthcare version, Margot. Morton, Morton, and find me on LinkedIn and give me a whistle. More than happy to have a yarn anytime.
Fun fact, Margot Robbie is actually a Darling Downs local from Dalby. We will put all those...
She
I don't know how often she comes back, but she's from here. We'll put all those details, like I said, in the description for the podcast so that people can get in contact.
And Margot, thank you. Yeah. Thank you for your time. I always think there's two people in the world. There's people that talk about it and there's people that do. You're definitely the doer. You're the person in the arena with their blood and dust on their face. So thank you for doing what you do and wishing you all the best and success.
Oh, thanks, guys. I'll have to get you down to Tenterfield when we go live there.
Beautiful.
That's good. Stay connected with the conversation about enhancing livability through sustainable healthcare solutions for regional Australia. Visit statum.com.au/podcast to learn more, connect with us and join the movement towards a healthier future for our regional communities.